Welcome to Inside 340B Report, an insightful conversation between 340B Report's editorial team on the key issues affecting the 340B drug discount program, the nation's second largest government drug program. Hello and welcome to the latest episode of Inside 340B Report. I'm Ted Slafsky, publisher and CEO of 340B Report, and I'm joined today by Shannon Young and Will Newton, who are associate editors and senior writers at 340B Report, and Luke Zarzecki, our national correspondent. Before we dive into the latest 340B developments, I want to let our listeners know that we're pleased to offer a special 25% discount to 340B Report for first-time subscribers. You can go to the subscribe tab at 340breport.com and use the coupon code podcast25 to take advantage of the discount. I know you will find our news service to be a valuable investment. Also, I want to encourage you to check out 340B Report's business-focused podcast, 340B Leaders Up Front, hosted by Anna Mangum. The podcast showcases conversations with industry executives who are at the cutting edge of innovation and leadership in the 340B space. There's been a lot of major developments in the 340B world since our last episode. Today, we're going to discuss the latest on Capitol Hill, including an upcoming healthcare provider hearing before a key House subcommittee and a leadership shakeup that could affect the bipartisan 340B Gang of Six. Reactions to another major drug maker's recent announcement that it plans to require in-house pharmacy data reporting in order to access 340B pricing. Two major 340B-related developments in the federal courts, and two very divergent state 340B program bills on the cusp of becoming law. Shannon, tell us more about this hearing that I think is coming up next Wednesday. Is that right?
Yeah, so the Energy and Commerce Committee's Health Subcommittee just announced a March 18th hearing entitled Lowering Healthcare Costs for All Americans, an Examination of the U.S. Provider Landscape. So the E&C Committee has jurisdiction over 340B and other healthcare issues on Capitol Hill. But the reason this is so interesting is because it is the third in a series of hearings that the E&C Committee and subcommittees have had in the last couple of months looking at the drivers of U.S. healthcare costs. So as of recording, it's Friday, March 13th, the committee hasn't listed the witnesses on their website. However, a committee spokesperson told us that witnesses confirmed for the hearing include the American Hospital Association, the American Medical Association, the American Academy of Family Physicians, and the Purchaser Business Group on Health. And so it's going to be interesting to see whether 340B comes up at this hearing. It hasn't really been a key topic at some of these other hearings, but it did come up at a February 11th E&C Health Subcommittee hearing on the prescription drug supply chain when PhRMA, so Pharmaceutical Research and Manufacturers of America, criticized hospitals' participation in the 340B program. They echoed a lot of the talking points they've had about 340B in recent months, including that it's a, quote, hospital markup program. And so it remains to be seen whether 340B will be a topic. The hearing announcement didn't specifically call out 340B, but with the American Hospital Association on there as one of the witnesses, it's likely that it could be discussed. The AHA, as you may remember, was the key hospital group that sued to block HRSA's 340B rebate pilot in Maine Federal District Court back in December. They ended up winning that case, and it got appealed to the First District of Boston, which also upheld that and stopped the rebate pilot from taking effect. So I'm sure that they may get some questions about that and the rebates, since this has been a big topic recently. And Capitol Hill lawmakers even did bring up the rebate and their concerns about it during their recent negotiations on an appropriations bill that funded the agencies that oversee the 340B program. So we're going to keep an eye on it. We'll be covering it. We'll plan to be in the room to be there to see if anything happens. But that is what we're keeping our eye on right now. And Luke, that wasn't the only thing that happened on Capitol Hill this week. You had some reporting about some shakeups there that could affect the group of 6 lawmakers that are working on a high-profile 340B reform bill. What can you tell us there?
Yeah. So after President Donald Trump announced that Kristi Noem would be stepping down from leading the Department of Homeland Security, Senator Markwayne Mullin from Oklahoma was nominated to take that spot. And as many of you know, Mullin is part of the Senate 340B working group, and he had joined after Senator John Thune was elevated to be majority leader, and Mullin took his spot. So now, if Mullin is confirmed to lead DHS, they are looking for a new senator to join, and our sources told us that any replacement will most likely be a Republican who has not taken a clear stance on 340B, so that group can come to a compromise on the Sustain Act, which they are currently working on.
Yeah, that's really interesting, Luke. Mullin's tenure on the Gang of Six has been fairly short, but I guess getting the opportunity to head one of the largest federal agencies in the world is maybe even more important than serving on the Gang of Six. I'm not sure why, personally, but I guess that's the case. Thank you for that good reporting, Luke. Will, turning to another topic, I know that Novo Nordisk made some news very recently. Can you tell us more about what they're trying to do and what the reaction has been?
Yeah, definitely. One of the biggest 340B developments since our last podcast was that Novo Nordisk recently announced that it plans to begin requiring covered entities to submit 340B claims data on their 340B utilization at in-house pharmacies starting on April 1st. And this came just a little bit after, and we discussed this in our last podcast, Eli Lilly announced a similar policy, which took effect on February 1st. Both of those manufacturers are saying that if covered entities don't submit claims data for in-house pharmacy use within 45 days, then they could be denied access to 340B pricing. Novo's policy, again, it is supposed to take effect April 1st. Lilly's took effect at the beginning of last month, so we're about to reach kind of the first 45-day period, and we'll be closely watching to see whether or not Lilly does, in fact, go forward with denying 340B pricing for covered entities that don't comply with this policy. And these policies in particular are a really large expansion from some of the previous claims data reporting policies we've seen. At this point, as our listeners probably know, most large manufacturers have policies in place requiring covered entities to submit 340B claims data on 340B utilization at contract pharmacies to their vendor 340B ESP. These policies, though, would require this at in-house pharmacies. So pharmacies that are part of the covered entity have the same address as the covered entity. So this is certainly a really big development. Exelixis, which is a much smaller specialty drug manufacturer based in California, last year actually announced a policy requiring in-house pharmacy claims data reporting. That appeared to be the first one to do so. But Lilly and Novo Nordisk, given the size of those companies, their policies this year are really significant. And I think something else pretty interesting about these two drug companies in particular is that they are the leading manufacturers of GLP-1s, the obesity drugs that are, just a humongous, very rapidly growing market right now. And I spoke to a source who said that hospitals and health centers who prescribe GLP-1s, these drugs a lot, and the outpatient setting are really going to be hit the hardest by this policy. So that's sort of an interesting early connection between them there. It'll be interesting to see and predict, to what extent that played a role in their decision to move forward with that. And more importantly, see how these policies actually play out once we start hitting these 45-day thresholds. And since this news has happened, I know there has been quite a lot of controversy and very different reactions from the provider and drug manufacturer communities. Luke, can you tell us a little bit more about how different stakeholders have been reacting to this news?
Yeah, so as many of you could imagine, the provider groups were pretty upset with the new policy, with America's Central Hospitals and 340B Health both sent letters to HRSA asking the regulator to stop the policies, saying they go against the 340B statute. Meanwhile, the Ryan White Clinics for 340B Access, they sent a letter directly to Eli Lilly asking them to rescind the policy, though they also sent that letter to HRSA. The groups are saying that the policies increase both financial and administrative burden, such as more staff and more IT work. And the Ryan White clinics are saying the policy decreases the ability of HIV and AIDS healthcare providers to do the jobs they need to do. The drug makers say that the data is pretty basic and it will increase transparency and integrity. And they say that data is available and that the concerns around the burdens are unfounded.
That's really interesting, Luke. I think that is going to be a huge battle, this issue of the new claims requests, because I anticipate there to be litigation soon that challenges these efforts. So from my 30 plus years of experience in 340B, this is a big change when it comes to the level of data that would be required. And the providers do not think that this is legal. So stay tuned. We will certainly be reporting on that. There's been a lot of other things going on in the courts as well. We've been covering, seems like every few minutes we're on Pacer looking for the latest news. For those of you who are not familiar with Pacer, it's basically a service that tracks court cases. And when you are in the world of 340B and you have to follow legal issues, Pacer becomes a very important service and one that we've become quite dependent on. So, Shannon, why don't you tell us about, there was a big court decision that sided with the hospitals just recently. Can you tell us about that?
Yeah, Ted. So that was in a case that is been lovingly referred to as a child site case. The U.S. District Court for the District of Columbia, so a D.C. Federal District Court, issued a March 3rd ruling that struck down HRSA's contentious 340B hospital offsite clinic registration policy. So that ruling marked a major victory for hospitals that have long opposed the policy, and it came just 2 months after the court heard oral arguments in that case. The judge found that HRSA's policy, quote, conflicts with the text of the 340B statute and therefore is contrary to law, end quote. So a little bit of background on this case. HRSA's waiver stemmed from a June 2020, so COVID era, FAQ on the 340B program that related to the pandemic related flexibilities. It told 340B report at the time that the updated policy was in place regardless of the pandemic. And the judge's ruling cited this communication from a, quote, public affairs specialist to 340B report in his ruling. So we got a shout out there, which is always interesting to see. HRSA withdrew.
That's exciting news, Shannon. I love it when 340B report or our news publication gets referenced by the judges throughout the country. So very cool.
Yeah, it's always nice to know that somebody is reading the things we are putting out there. And so HRSA withdrew the FAQ and all of its other 340B program COVID flexibilities when the federal emergency expired in May 2023. Health systems sued HRSA in October 2023 when the agency ended the registration policy that allowed hospitals to access 340B pricing at outpatient sites or child sites before they were formally listed in hospitals' Medicare cost reports. And they argued that HRSA's decision to reverse the expedited child site registration policy was unlawful, that it exceeded HRSA's authority under 340B statute, and that HRSA failed to present the registration waiver as a temporary policy. So we reached out to HRSA on this ruling. They didn't comment to us on it. They haven't said anything. As far as I've seen, the government has not yet appealed this case, but they have 60 days to do so. And, since most 340B related cases end up going to appeals courts, I wouldn't be surprised if this one also did. So, Ted, I'm just curious, as somebody who's been watching this issue for years and years, including before I even joined the team here, I would love to get your thoughts and opinions on this ruling and its significance.
Yes, Shannon, this was a huge decision because as many of you may know, before I started 340B Report, I was a longtime advocate for the program as the CEO of 340B Health, the trade group for the hospitals in the program. And this was this particular policy that HRSA has had for many, many years never made sense. At least that's what the hospitals believed, because when they were adding a new site, an off-site facility, they would assume that they would be able to get access to the 340B discounts. Let's just say it's an infusion center or some other type of clinic that was opened up closer to where patients live. And they would have to wait up to 23 months before accessing 340B pricing and instead pay much higher prices, which was really problematic for their patients and for their mission. So we had been urging HRSA for many, many years to change this policy with no luck. But then during COVID, suddenly they said, we've changed the policy. And not only have we changed this policy, but it's a permanent change. And 340B report, as the judges noted, reported on this. And HRSA had told us that. And then suddenly they decided to change their mind again at the end of the pandemic. And then this court, a number of hospitals sued, and they've been successful. So I know there's a lot of joy in the hospital community right now during a time when they've had some success with the legal circles and they've had some challenges. So this was a big victory for them.
So let's turn to another major court case that we've been watching. Will, what can you tell us about the latest in lawsuits challenging state contract pharmacy access laws?
In our last podcast, we discussed a very big, really unexpected turn in a lot of these lawsuits, which are drug manufacturer lawsuits challenging state laws that prohibit them from placing contract pharmacy restrictions on 340B providers. And the really unexpected change was that the federal government, specifically the Justice Department and Health and Human Services Department, joined in and filed some amicus briefs, friends of the court briefs, that were backing drug makers in those cases. Before that period, the federal government had been pretty neutral and hadn't really said anything, and these had been legal battles happening between states and drug manufacturers. Since that initial surprise, the government has really doubled down on its position and continued to file more of these briefs. So we saw the federal government filed an amicus brief backing pharma in a First Circuit Court of Appeals appeal of a ruling that upheld Maine's 340B contract pharmacy access law. We also saw the government file a brief backing AstraZeneca in its appeal of a ruling that upheld Colorado's 340B contract pharmacy access law. And the first two amicus briefs were backing AbbVie and Pharma in some other appeals. Again, this is pretty significant because the government had not really weighed in on these cases so far, and because of its potential to affect the outcome of these cases. Of the 20 or so states that have enacted contract pharmacy access laws, all of them have faced multiple drug manufacturer legal challenges. Courts that have issued rulings so far have pretty overwhelmingly sided with the states, with the exception of two federal judges, one in Oklahoma and one in West Virginia. That said, most cases are ongoing or under appeal. And so the fact that the government joined in could be pretty significant. Some attorneys have told us that these appeals courts certainly will weigh what the government has to say and take it seriously. That said, they're not required to abide by what the government says. They're not required to adopt the government's position, particularly if they don't feel that that position is well-reasoned or if it conflicts with prior positions held by the government. Another final really important thing about this, and we discussed this last time and did some reporting on this earlier, is that a couple of the top Justice Department attorneys who signed these briefs, it was not their first foray into 340B or drug pricing matters. And in fact, the most senior Justice Department official who signed all four of these amicus briefs, he, up until January of 2025, worked for a private law firm where he was counsel to Sanofi in multiple 340B related lawsuits, including one challenging Arkansas's 340B contract pharmacy access law, as well as a separate one seeking to implement a 340B rebate. But the Arkansas one in particular, right, it's incredibly similar, the arguments he was making as counsel for Sanofi to the arguments that the government is now making backing drug manufacturers in similar cases. A Justice Department official told us that this did not constitute a conflict of interest, but it's certainly something to be aware of and take into account as we're trying to sort of analyze and break down why the government did this, what it could mean, what the implications are. And so we are going to be closely following to see how these appeals courts respond to these new briefs that are certainly a win for drug manufacturers in these cases.
Will, that was great reporting to find that the fact that these two attorneys used to work on behalf of the drug industry and now are arguing on behalf of the government was really quite remarkable and excellent reporting. So congratulations on that. With that, we're going to, before we continue, let's take a moment to hear from one of our great sponsors.
Compass RX is the premier AI services platform built exclusively for 340B. With our unique blend of pharmacy and AI expertise, we help you maximize your 340B savings by maximizing pharmacy capture rates, putting your team into hyperdrive, and ensuring you aren't leaving any money on the table. Our mission is to unlock the power of AI for 340B. Head to compassrx.com to learn more and see if AI can solve your magic wand problems.
So, Will, there's been a lot going on in the state legislatures over the last few weeks. Can you tell us about some of the developments going on in the state capitals?
Yeah, definitely. The state where there has been the most action by far to start this year has been in Washington state, where there is legislation that would prohibit drug manufacturers from placing restrictions on contract pharmacies. And it would also add 340B reporting requirements for both covered entities and drug manufacturers. And this bill here, it has now passed the Washington State Senate and the Washington State House, largely along party lines with mostly votes from Democrats. And the bill was actually delivered on March 12th to Governor Bob Ferguson, who is a Democrat and the governor of Washington State. And so we are going to be closely tracking to see when the governor's timeline and deadline is to act on the bill, whether there's a signing ceremony, and when this bill that looks like it's well on its way to becoming law actually gets finally signed. And a couple things that are pretty interesting about this law. Mainly, it's that it includes manufacturer reporting requirements alongside provider reporting requirements. We've seen there's about 10 states right now that, including Washington, that have laws that require providers to report additional information about their 340B programs, usually some financial information like their total 340B savings, the total cost of 340B drugs, their contract pharmacy utilization, things along those lines. But it really kind of varies quite a bit. And Washington State is one of the first to pass one of these laws, but it was pretty weak in terms of enforcement, and it didn't really materialize into much of a significant report in the way that we've seen in Minnesota. But this new bill that's on the verge of becoming law, it would really strengthen the reporting requirements. So an enforcement authority would require providers to report much more data. And it would be the first to also require some manufacturers to report data about their 340B programs. This would be things like the total discounts that the manufacturers gave out in any given year, et cetera. So that's really interesting. And it'll be interesting to see if other states end up following that as well, as we've definitely seen a surge in 340B provider reporting laws. The other pretty interesting thing is that, if we look back to this time last year, there were so many bills on their way to becoming laws, if not already laws. This year, it's really Washington State. And so that's sort of the other interesting thing. And part of the reason that is the case is that other states that have tried to enact contract pharmacy bills have had much less success this year. And Virginia is the best example of this, because there was a bill in Virginia. It was pretty standard. It would prohibit drug manufacturers from placing 340B contract pharmacy restrictions. It was introduced. It cleared a committee in the Senate, But then the second committee that saw the bill in the Senate ended up basically removing all of the contract pharmacy provisions and replacing it with a work study group, basically just requiring different stakeholders from community health centers, hospitals, pharmacists, drug manufacturers, et cetera, to conduct a study of the 340B program and come back to state legislators with some recommendations for potential policy changes that could take effect in later years. And so far from a contract pharmacy bill, just kind of a broad study. That bill has since passed the Virginia Senate and the Virginia House, and it will be on its way to Governor Abigail Spanberger, who is a Democrat and was a 340B advocate back in her time in U.S. House. And so that looks as well like it's on its way to becoming law. It's not really significant in that the law is going to do very much that will affect the 340B program. Again, it's just a study group, but it is significant in that this was a state that a lot of people had their eyes on as a likely candidate to pass a contract pharmacy access law. This law, though, guarantees that that will not be the case, at least this year. And Ted, I know that you are a resident of Virginia and you've been following this closely as well as all state legislative activity on 340B very closely. I'd love to hear some of your thoughts.
Yeah, it was really a big surprise to me. I thought for sure that there would be a contract pharmacy access bill passed in the state this year. You had what looked like all the stars aligned. You had Abigail Spanberger as the new governor. She's a big champion of the 340B program, one of the really, really vocal advocates for the program during her time on Capitol Hill. And we had a Democratic Senate and a Democratic House here in Virginia. There was basically a major change in governance in the state with the recent elections. But despite that, the bill ended up not passing, even though the last session, it actually passed with big bipartisan support. So this was, and then it got vetoed by Governor Youngkin, a Republican. So I thought things would be very different this time. So this was a surprise to me, and it will be interesting to see what happens. I know, Will, there are a couple of states where we're expecting action at some point, including Illinois and Michigan, which are on the verge of passing these bills, but it hasn't gotten there just yet. Is that right?
Yeah, so there's a number of states that have 2-year legislative sessions. So there were bills introduced in Michigan and Illinois and Kansas that all passed one state legislative chamber last year and have stalled since then, but are still alive, still active. And so they would now need to pass the opposite chamber this year. I know in Illinois in particular, providers have made a big push to try and get movement on that bill. So apart from Washington State, where there in all likelihood will be a law, those are really the main states to look at as well.
Yeah, well, we'll be keeping a close eye on it. I know that the early part of the years where most of the action goes on in the states, but, you know, as you mentioned, some of them have these 2-year sessions and come back even in the summer. So you can guarantee that 340B report will be there to cover those issues and all the other topics of interest. So we'll keep an eye on all things 340B related, and please keep us updated if you have any story ideas or tips. We're all interested in hearing what's going on in the field, and we'll be back in 2 weeks. In the meantime, you can follow along with our twice weekly newsletters and our breaking news stories. And just a reminder, if you're not a current subscriber, you can take advantage of our 25% discount for first-time subscribers only by going to 340breport.com, clicking the subscribe button, and using the discount code podcast25. Thank you so much for joining us, and we'll see you in 2 weeks.